This video is for educational purposes only. Viewer discretion is advised due to graphic surgical content. For medical concerns, please consult a healthcare provider. Pause to review the patient's details before the surgery begins. Okay, I start with the surgery, starting with the incision, going vestibular to the wisdom tooth and vestibular to the second molar. We'll create a sulcular incision and create initially an envelope flap which is positioned vestibular to the second molar and vestibular to the wisdom tooth. As you can see, now I'm vestibular to the wisdom tooth, going in medial direction. Now I'm proceeding with a distal incision on the anterior border of the ramus of the mandible, connecting it to the sulcular incision. Okay, now I will elevate the flap. I'm starting from the papilla between the second and the third molar, elevating the papilla with an periosteal elevator. Now you can see I'm elevating the papilla from the bone and proceeding in distal direction, vestibular to the second molar, vestibular to the wisdom tooth. Now I'm elevating the area where there is the distal incision from the wisdom tooth, and as you can see, now I'm going lingual to the wisdom tooth. Good retraction of the flap so I can see the bone. Okay, I'm starting with the osteotomy, going vestibular and distal to the wisdom tooth so I can remove the bone in this area. Removing bone, vestibular to the wisdom tooth. Good rinsing so I remove the debris. Again, continuing with the osteotomy. Now I'm going distal to the wisdom tooth and vestibular too. Good rinsing of the area. As you can see, I'm using a lot of saline so I can remove all the debris. Now I am creating a vertical incision distal to the second molar. This way I am transforming the envelope flap into a triangular flap, which will allow me for better visualization of the area. Now you will be able to see how I elevate the whole flap, and my assistant is retracting it with the retractor. Now I'm continuing with the osteotomy. You can see me removing bone vestibular in the mediovestibular area of the wisdom tooth, going just around the crown and the roots, removing bone to the side of the tooth. Now I'm positioning the retractor a bit more distal so I can visualize the distal area of the wisdom. You can see I'm going in the distal area of the wisdom tooth, removing bone in the distal vestibular linear angle. Okay, I will try to luxate the tooth with a straight elevator. If you find this video valuable, hit the like button, subscribe and comment. As you can see, it's not luxating at all, so now I will proceed with separation of the crown from the roots with an angled handpiece. As you can see, with an angled handpiece it's quite easy to separate the crown from the roots. Again, good irrigation of the area. Okay, let's try to separate it, to fracture the crown from the roots. Yes, quite easily it's fractured. And now I'm luxating it in occlusal direction. Yes, you can see the separation. Again, I will try to luxate the roots now, but as you can see, they're quite stuck. Using a bit wider straight elevator, trying to luxate them again. Going from vestibular, trying to luxate them in anterior direction and a bit lingual. No luck, so I'm continuing with the osteotomy. Now I will try to separate the roots, to separate the distal from the medial root, so I'm going with the horizontal cut with the straight handpiece. Good hemostasis so I can see. Okay, the horizontal cut which will separate the medial from the distal root. As you can see, I'm more or less cutting in the middle of the tooth. Try to imagine what is the direction of the roots and more or less be parallel to this plane, so you end up cutting, separating both roots. Good rinsing again. Okay, now I'll fracture the middle from the distal root. Again, trying to luxate it. It is starting to luxate a bit, as you can see. There is a bit of movement in the root, but still it's not coming out. Trying to push it. Okay, I will continue because the roots are still not separated, just a small piece of the distal part of the crown has fractured. Now I will continue with the separation of the roots. Again, good irrigation. Okay, I'm trying to fracture them again to separate the distal from the middle root. Now I'm pushing the medial root. Yes, it has come out. You can see the root. sutured, and the distal root is still in place. I will try to luxate it too. Going from vestibular, because the bone there is thick, there is the external oblique line, so I can trust it for fulcrum. Trying to push the tooth in anterior direction. I'm searching for that sweet spot that will allow me. Okay, you can see the root coming out. And there is one more left. So the distal root consists of two separate roots. One vestibular and one lingual. Now I'm removing the lingual one. Okay, you can see it's quite curved. Okay, we are ready with the extraction of the tooth. Now we need to take care of the wound. Look for any mobile pieces, so any fractured bone or sharp bony pieces that should be removed. Good rinsing of the area. Always when you cut the tooth in few pieces, rinse the area thoroughly, because there are a lot of small pieces left in place which can lead to post-surgical inflammation. Okay, now I am smoothing the sharp bony edges so that they do not perforate the flap. Okay, moving the retractor in more anterior direction. Again, smoothing out the sharp bony edges from the osteotomy. Okay, so I'm curating the wound. As you can see, I do it through the gauze. This way I am collecting all the debris, all the bony debris or the small pieces from the tooth which are left in the wound. They stick to the gauze. Again, continuing with the removal of the sharp bony edges. So now I think I'm smoothing the distal area where the bone is sharp. Going lingual. Again, rinsing, thorough rinsing. I use a lot of saline. Smoothing out the external oblique ridge. Curating through the gauze, as I told you. Okay, now we'll do a periosteal incision. This way we can mobilize the flap and, let's say, make it more elastic. This way we can close the wound and let it heal with primary intention. You can see I'm incising the periosteum, pulling on the flap and incising the periosteum. While pulling on the flap, you can feel where exactly there are the periosteal threads which are preventing the flap from mobilizing it, and then you just focus on them and cut them. Now I'm doing a blunt brushing technique of the flap so I can elongate it. You can see it's quite mobile. I would just trim the edge of the flap so it's a clear wound surface, not a gingival sulcular epithelium. Good rinsing of the area again, as you can see. Gelatin sponge in the wound. Okay, now I'm starting with suturing. I will use a mattress suture to position the flap. So I place it in its new position. Going from vestibular, coming out lingual, then going in lingual, coming out from vestibular. Now I'm crossing the needle through the lingual loop. And tying up the knot. Again, I'm placing a suture going from lingual, coming out vestibular, through the vestibular flap, again going through the lingual, and coming out vestibular. This creates an X shape of the suture, which is quite useful. Again, doing the same suture. knot. You can see the distal area of the flap. It is closed quite well. One more suture at the most distal part of the incision. Again, the X-shaped suture. Now I'm focusing on the vertical incision that we did additionally. There we need to close it too. Okay, and we are ready with this extraction. Full closure of the flap.
The technique shown here is just one of many approaches. It's not about claiming the best method, but about sharing experience and learning together. If you find it valuable, hit the like button, subscribe, and drop your questions in the comments below. You can join our mission by contributing on Patreon.